Well, I suspect they'll be having a Senate.
Good morning. Will the Senate please come to order? This morning we'll have a brief moment to get the week started. Good morning.
Good morning.
Please rise if you're able for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Are there any announcements? Senator from Chittenden Central.
Thank you, Mr. President. I have a couple of announcements. Two with regard to the Rules Committee. First, there will be a brief Rules Committee meeting immediately following the floor. So if members of the Rules Committee could just stay for a minute or two. There are a couple of charters we've been asked to move out of rules. The second piece has to do with our financial disclosure forms. So as you may have seen, there's been some attention to the House and the Senate's disclosure forms and our procedures for filling them out and registering them. So the Rules Committee discussed access to them and whether they should be moved online, and the unanimous decision was that they should. So this is a notice to all senators that those forms that you filled out by hand and that have previously been stored physically in the Senate office only will now be available in the office or online. It's always a senator's option to update those forms, so if you feel that for any reason you need to update them, now might be a good time to think about that. And then, Mr. President, if I might, I have a motion to make, and that is, I would move that the rules be suspended and that H-494, an act relating to making appropriations for the support of government, not be referred to the Committee on Finance under Rule 31.
Now, the Senator from Chittenden Central has moved that the rules be suspended and H-494, an act relating to making appropriations for the support of government, not be referred to the Committee on Finance under Rule 31. Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it, and you have voted to not suspend your rules, in order to not have H-494 be referred to the Committee on Finance under Rule 31. That bill appearing for notice will be up for action the next calendar day. Senator from Chittenden Central.
Thank you, Mr. President. One last announcement. Following today's floor session, we will have an all-Senate caucus with the Chair of Appropriations giving us a long update on the budget. So if senators could remain in their seat when we gavel out, and a special note to senators on Zoom that we will be continuing following adjournment. So if you can remain with us, that would be great. Thank you, Mr. President.
Are there any further announcements? Seeing none, we have a number of bills for rule referral. The first being S-148, appearing on the calendar for notice, will be referred to the Committee on Rules. We have H-62 appearing on the calendar for notice, affecting the revenues of the state, will be referred to the Committee on Finance. We have H-282 appearing on the calendar for notice, affecting the revenues of the state, will be referred to the Committee on Finance. H-102 affecting the expenditures of the state will be referred to the Committee on Appropriations, and H-126 appearing on calendar for notice affecting the expenditures of the state will be referred to the Committee on Appropriations. We have two gubernatorial appointments to refer to committee. The first being H. Dixon Corbett of East Thetford, Vermont, as a Superior Court judge from April 14, 2023 to and including March 31st. Will be referred to the Committee on Judiciary. And we also have the appointment of Robert Kadams of Heinsberg, Vermont, as a Superior Court judge for a term from and including April 14, 2023 and including March 31st, 2028. will be referred to the Committee on Judiciary. We now have up for consideration our weekend adjournment resolution, JRS 25. Please listen to the reading of the resolution.
JRS 25, Joint Resolution Relating to Weekend Adjournment. Resolved by the Senate and House of Representatives that when the two houses adjourn on Friday, April 28, 2023, it be to meet again no later than Tuesday, May 2, 2023.
Now you've heard the reading of the resolution. The question is, shall the Senate adopt the resolution? Are you ready for the question? All those in favor, please indicate by saying aye. Aye. Those opposed indicate by saying nay. The ayes have it, and you've adopted JRS 25. We now have a resolution to be read and placed on the calendar for action, JRH 5. Please listen to the reading of the resolution.
JRH 5, Joint Resolution authorizing the Green Mountain Girls State Educational Program to use the facilities of the State House on a mutually agreed upon day and for a designated time span during the week of June 18, 2023.
Now you've heard the reading of the resolution, and it will be placed on the calendar for action on our next legislative day. We have two Senate bills for introduction. The first being S-149. S-149 was introduced by Senator Sears. Please listen to the reading of the bill by title.
S-149, an act relating to dram shop liability insurance.
Now you've heard the first reading of the bill is referred to the Committee on Economic Development, Housing, and General Affairs. We have for introduction S-150, also introduced by Senator Sears. Please listen to the reading of the bill by title only.
S-150, an act relating to automobile insurance.
Now you've heard the first reading of the bill is referred to the Committee on Judiciary. We now have up orders of the day. We are going to continue discussion of a bill that we were interrupted by technical difficulties on the last legislative day, you may recall. That is H-222, an act relating to reducing overdoses. The bill was read for the first time and referred to the Committee on Health and Welfare, which considered the same and recommended that when amended, the bill ought to pass. The bill was then referred to the Committee on Appropriations that recommended that when the bill is amended, it ought to pass. I'd like to recognize the senator from Addison who was partway through the report on the bill to continue the report of the Committee on Health and Welfare.
Thank you, Mr. President. Good morning, everyone. We were left in a bit of a cliffhanger on this bill on Friday, so I will start by giving you just a reminder, a sort of previously on kind of reminder, so you remember what this bill is about. This bill H-222 is a bill about reducing overdose deaths in Vermont. It includes a lot of provisions to make sure that treatment and recovery services are more accessible, that medication-assisted treatment and other means to help people who are struggling with opioid use disorder are able to get the services they need. As the internet went out on Friday, I was discussing a provision in the bill related to drug checking. And I do also want to remind you, you had on your desks on Friday this chart that shows the number of opioid deaths and the rate of opioid deaths and how they have been increasing over the past decade. So the sort of urgency of this problem. So the drug checking provision, I was at this point going over the amendment of the Health and Welfare Committee. This is a program that already exists in a pilot form in Vermont, and this would be expanding that pilot under the guidelines of the Department of Health to allow residual amounts of drug substances to be tested to let folks know what the contents are, whether they have fentanyl, xylazine, or other substances that are extremely deadly. The program would be confidential for people who provide the substances, and the Department of Health would use information from the substance tests to determine what is in the drug supply statewide. I want to be clear that the department wouldn't be authorizing the programs, but they would be providing guidance on the programs. So that was the language, and if I can refer you to the amendment, which actually starts on page 1596 of today's calendar, which is pretty much the first page if you open up the calendar. The first part is the language But now I want to move to the second part, which is section 14 of the bill, which are the appropriations. And just a reminder, these are from the Opioid Abatement Special Fund, which are the funds that the state of Vermont receives from the settlements from pharmaceutical companies that were involved in promoting the use of opioids and their part in the opioid epidemic. So this is a fund that was set up last year, and there was a advisory committee set up to advise the Department of Health and then the legislature and the governor on how to spend these funds. These funds, over the next 18 years, the state of Vermont is expected to receive over $100 million in these settlement funds. They can only be used for opioid use treatment, recovery, prevention services. They can't be used for something else. So that the advisory committee was very careful in making sure that we are spending them for the appropriate uses of the fund. They also can't replace other funding that has already been appropriated. So it needs to be used for new services, new prevention, new treatment options. And that's what you'll see. I did get a question from a senator about that during the interim when I reported on Friday. So it's a lot of money, and it's for very targeted purposes, but it's what is required for the use of the fund. So you'll see it first is $1,980,000 for the expansion of naloxone, which is Narcan, which is a preventive medication to use to prevent overdoses, for distribution of that to a much larger audience, including vending machines, home delivery, mail order, and harm reduction packs and leave behind kits for people who may be at risk. The next is $2 million divided equally for 4 opioid treatment programs for satellite locations. You may recall with our hub and spoke system in Vermont, we have hubs in lots of places in the state and spokes that go to the hubs for treatment, and but there are some parts of the state that don't necessarily need a hub, but are not getting covered sufficiently with the spokes. So these would be satellite sort of littler hubs that would be able to provide medication-assisted treatment for people who are experiencing opioid use disorder. The 4 locations would be on the eastern and western sort of mid part of the state, Addison County and between the Northeast Kingdom and Brattleboro, and then an additional smaller site or an expansion of the current site in Chittenden County, and then a facility operated in a facility of the Department of Corrections. It would probably be in the northeast facility, but they would figure out the best place, and they could even move incarcerated individuals who need the services in order to get them that treatment. The next appropriation is $1,976,000 to fund outreach and case management staff on frontline organizations within the preferred network, preferred provider network, and syringe service organizations. That would be 26 positions to really help reach people who are experiencing opioid use disorder. And then $240,000 for the 4 syringe service organizations. This, you'll see an amendment from appropriations that increases that amount so that it would be $400,000. So each of them would get $100,000. There's $840,000 to provide contingency management services to individuals with substance use disorder. Contingency management is a type of treatment that was actually spearheaded and developed here at the University of Vermont Medical Center, and it is to provide assistance to people who are really having a difficult time, and they get incentives to be able to come back, get tested, get treatment, get connected. It's a highly effective, evidence-based program that was spearheaded here in Vermont. $100,000 for wound care telehealth consultation, particularly with the increase of the use of xylazine. It creates really terrible wounds for people who use the substance, and they can't always get to a medical care provider in person. So this would allow for a pilot for telehealth for wound care. $200,000 to expand the distribution of fentanyl test strips, and if available, xylazine test strips. Xylazine test strips are available, so the Department of Health would basically put in a bulk order for these, and these are, again, to test the drug supply to make sure it does not include fentanyl and xylazine. And then there's $700,000 for the drug checking program that I just went over. The grants would be awarded by the Department of Health in each of these cases. So that is the use of, that is the amendment and the use of the funding from the opioid settlement. So, Mr. President, I will just finish my summary, and then I believe there are a couple other amendments. I'm certain that everyone in this room knows someone who has either died of an overdose or had their lives turned upside down due to the tragic health implications of opioid use disorder. We can't continue with business as usual or rest on our laurels of the hub and spoke model alone. We have to do more and do better, supporting efforts of healthcare providers, frontline treatment and recovery organizations, and Vermonters who are struggling each day to overcome this brutal disease, which saps them of their humanity and ability to live dignified lives. We have worked to move quickly on this bill, which has the consensus support of the administration, the other body, opioid treatment advocates, and Vermonters with lived experience with opioid use disorder. While there is more to be done to end this public health crisis, this bill is a great step forward in applying innovative and effective harm reduction and treatment measures to the opioid epidemic that tragically continues to grip Vermont. Mr. President, we heard from a number of witnesses, including the reporter from the other body, of course, Legislative Counsel and Joint Fiscal Office, the Department of Health and the Department of Health, Vermont Health Access, the Medical Society, Vermonters for Criminal Justice Reform, the Drug Policy Alliance, a number of pharmacy outlets, the Overdose Prevention Network, the Lamoille Health Partners, Blue Cross Blue Shield, and Vermont Cares. We also, the Health and Welfare Committee, just days before we voted this bill out, took a visit to Jenna's Promise, which is in Johnson, Vermont. And if you haven't visited, I highly recommend it. It is an excellent program, completely comprehensive in its use of opioid treatment disorder and all of the wraparound services. It was started 3 years ago, I believe 4 years ago, just before the pandemic, by the Tatro family after they lost their daughter, Jenna, to an overdose. It is an amazing program and reminded all of us on the committee of what's at stake and what the good work that's being done in our communities. Mr. President, the vote in the Senate Health and Welfare Committee was 5-0-0, and we ask for your support. Thank you.
The bill is then referred to the Committee on Appropriations, which considered the same and recommends that when amended, the bill ought to pass. For the report of the Committee on Appropriations, the Senator from Chittenden Southeast.
Thank you, Mr. President. If you look, I'm looking at Friday's calendar, but it's also on today's calendar following the bill that was just reported by the Senator from Madison. Your Appropriations Committee made a few changes to the bill we think helpful. First, in section 14, where it talks about the satellite programs, we've struck the phrase between Northeast Kingdom and Brattleboro, and